Welcome. It is a huge honor for me today. We're in Johor Bahru, Malaysia.
That's right.
Johor Bahru, Malaysia.
Welcome to Malaysia.
With Dr. Matthew Hong. Thank you so much for having me in your office. You are a legend. There's 30 million people in Malaysia, and you have the only CEREC CAD-CAM machine in Asia.
Yep.
And your lovely wife was Miss Malaysia Universe 2015 and is the spokesperson for Sirona Asia, correct?
You are correct.
Yeah, well, so...
I'm honored.
It's an honor. So how does it feel to be the husband of a wife that made Miss Malaysia Universe?
I should say that I was very, very lucky. So, and it just coincidentally that she liked competition. She wanted to be top of her games, and then she had this chance, so she grabbed it, she got it. So I'm very happy, and I'm lucky to have her because she's helping me in all my dental career as well.
So how long have you guys been married?
Well, let me count. 12 years,
12 years?
12 years,
So now she's a spokesperson for Sirona Asia. Is that because you're you're associating beauty with all natural tooth-colored restorations, and why did you get a CEREC? Why you're the only CEREC user in Malaysia? Tell me about that part of your journey.
Of course, I always want to embrace high-tech dentistry. So, of course, Sirona is one of the biggest dental company in the world. So it's just naturally, we adopt whatever Sirona is providing us. I've been using this product for the last 1.5 years. It's beautiful products. In fact, I regretted that I haven't get it earlier. And also, since I embrace technology, 3D CAD-CAM is the way to go. So, like it or not, this is something that we have to learn and how to use it. So I'm lucky that I'm the first adopters in Malaysia.
So does your wife help your advertising in Malaysia?
Oh, she does. I think we leverage a lot on her reputation. So coincidentally, that we are very close with Sirona Asia. They are very happy with our dental relationship. So I think also right now, because she's famous now in Malaysia, so they want to leverage on her reputation.
So I want to. I like to talk about differences around the world.
Yep.
You went to dental school in
Sydney.
In Sydney, Australia.
Yep.
That's where my brother lives.
Yep.
And you're licensed there.
Yep.
You're licensed in Singapore.
Yes.
Which is this is the closest city in Malaysia. So you cross the bridge from here, and you're in Singapore. We drove in here this morning from Singapore.
Yep.
To see you specifically. And you're licensed in Malaysia, a country of 30 million, and
Yep.
you're also licensed in the UK, aren't you?
And UK, that's right.
UK.
That's correct.
So you could practice anywhere.
Yep. All the both country that you mentioned, I can practically practice there.
I can only practice in the United States.
Yep.
You can practice in Sydney, Singapore, Malaysia, London.
Yep.
So out of all those places, why did you pick here? Why Malaysia?
Very, very simple. It's home.
Home.
I was born here. I actually did my primary and secondary school here. I only went to Australia to do my tertiary and my degree. Then I come back to serve my country. As simple as that.
So home is always home.
Home is home.
Home is home.
I'm comfortable here.
So now, what is the difference? Like next door in Singapore, you're not allowed to advertise.
Yep.
In Malaysia, are you allowed to advertise?
No, in fact, in Malaysia, Singapore, by right, we are not allowed to advertise.
So it's the same as Singapore.
It's the same. It's actually under the same constitutions.
So so talk about that. How do you grow a cosmetic practice with CAD-CAM and Sirona and your wife, Miss Universe, if you can't advertise?
How do we do that? Basically, actually word of mouth. That will help. That help us a lot in many years. However, we do use a bit of social medias to help us. But I think, end of the day, what had helped us is actually we have done a good job, and patients are happy with what we do. So word of mouth help us tremendously.
And I think word of mouth is the most important form of
It is.
advertising
It
anyway.
is.
And I think that in countries where you're not allowed to advertise,
Yep.
I think it's actually better for the dentist because you have to work on your game. You have to be a good dentist.
Yep.
You can't just rely on doing some advertisement, getting 50 new patients. You got to
That's
worry
correct.
about keeping your 50 old patients. So I notice on your wall, you have more certificates, I think, of any dentist I've ever seen. I mean, you literally have a Hall of Fame. What courses have you've been a dentist for 20 years?
Yep. It'll be 20
What-
years next year. So
So what courses have you taken? What types of dentistry have you learned that looking back over the last 20 years,
Yep.
you're really glad you learned those courses, learned that technology? What do you like to do?
In fact, first of all, I will say, I embrace technology. That's why I think the best course I've ever taken is by Invisalign, which is a 3D type of invisible braces, okay, and also CEREC 3D training of prosthetics. Those actually benefit me a lot because as in Malaysia now, not a lot of people have the access to all 3D dentistry. So I'm glad that I started that. I want to be the first adopter and pioneer for 3D dentistry.
So you like 3D dentistry?
Definitely, computers, computer-aided design, computer-aided manufacturing. I think that is actually the way to go long term.
And are you doing other types of 3D? Like, are you placing implants?
Yes, I do. So we are embracing technology to actually do a better implants. So using 3D technology, the implant placement will be very accurate, will be very easy to make to handle, and also we can actually produce practices a lot of time within the same day. That's what patient want now.
And what would you say in Malaysia is your most popular dentistry? What do you do the most of?
I would say as per now, patient actually more after cosmetic dentistry. So I will say orthodontics and probably full mouth cosmetic corrections.
Now, do you also do like root canals?
I do. In fact, in our practice right now, we do all aspect of dentistry.
So you do everything.
Oh, I'll do basically everything. Yep.
So you don't refer out anything?
We try to keep everything in house.
Yeah.
This is actually how we practice in Malaysia.
Uh-huh.
Yep.
I love your. I also noticed this is the only dental office I've ever been in my life where everybody takes their shoes off at the front door. I don't know if you can pan to the front or whatever, but now
that's a lot of pair of shoes.
Is that a Malaysian custom
Yep.
or talk about that custom? I've never seen it anywhere in the world.
In fact, of course, this is the Asia way. In Malaysia, we practice that as well. In my clinic, I want to make patients feel more comfortable. In fact, most patients feel that when they actually take off shoes and walk into a clinic, they feel more at home. So that's actually why we practice that.
Well, that's what I do when I get home. When I get home, I take off my shoes.
Yep. So this is our clinics. This is our home.
Very nice. I wonder if I pitched that to my staff, what they would say if I asked everybody to take out their shoes for desk. What do you think they would say? Because he's right. We do that at home.
Yep.
Why don't we do it at our dental offices?
Some people would be, some people would say it's weird.
Yep.
I also noticed the girls behind your front desk are they're just all smiles and all
Yep.
giggles. Every time I ask them a question,
Yep.
they just giggle and smile. You
Yep.
seem to have a very happy team.
Yep, and I'm sure that they're happy to see you. All of you, actually. But, yep.
So you like to do endo, you like to place implants, you
Yep.
do Invisalign,
Yep.
you like to do CEREC. You're a man of many missions.
We like to call ourselves Super GP because I still like and enjoy all aspects of dentistry. So if I can, I think to treat patient as a whole, so you have to actually be able to tackle all patients' problem. And a lot of time, patient in Malaysia especially, they like to be seen by the same dentist from start to finish. So, and also I felt that it's easier for us to build a rapport with patients if we actually do everything from start to finish for them.
Now, do you use a hygienist to clean the teeth, or do you prefer to clean the teeth yourself?
We do not have hygienists in Malaysia as
You
per
do
now.
not have
Well, I would
hygiene.
not, so I do even dental prophylaxis for patients as well.
Do you like doing cleanings?
I would not mind. I don't mind that actually.
You don't mind it?
I don't mind that. You know, in fact, it's not the thing I enjoy the most, but I do not mind.
Yeah, it's very common in all of Asia to not really use hygienists. I mean,
Yep.
most dentists all do their own cleanings
That's right.
in Asia.
Yep.
Would you agree with that?
Yes. In fact, you know, I think only in Australia they do have dental hygienists. In many parts of Asia, dentists used to do basic cleanings, prophylaxis for patients.
I want to since you've been out 20 years,
Yep.
I want to a lot of the fans of the podcast are they're still in school. They just got out of school for a couple of years, and they're sitting there. They just graduating. There's so much to learn. I mean, what order do you think these kids should learn? I mean, you can't go out and learn how to place implants, do Invisalign, do CEREC, read a CB. I mean, you can't do it all at once. Is there any order that you like that you would give advice to the young kids?
Yeah, coming to that, you know, I do agree that, you know, you do need to learn your skills step by step. I think, you know, for the first 3 to 5 years, basic dentistry is very, very important because, you know, like we went through it ourselves. We start doing cleaning for patient, simple fillings, simple root canal, simple crown to start with. That enabled us to actually improve our skill, which we haven't learned that much during dental school. So I think for first 3 to 5 years, really is actually at the time to actually stick to the basic, do the basic, do it every day, day in, day out, get yourself very, very good at that. So they become imprint into you. So no one is going to take it away from you. Then after 3 to 5 years, when you think that, oh, I'm actually open up for more challenge, I can do something more complicated, then that's where orthodontic come in. That's where implant come in. Because, you know, for example, implants, a lot of people thought it's easy, but it's not. You have to know your a basic anesthetic skill, your surgical skill, your prosthetic skill, and occlusion as a whole. So, you know, they involve many, many things, which, you know, I think maybe for the first 3 to 5 years, it's very difficult for a young dentist to understand and grasp the concepts. So I think 3 to 5 year basic. After 3 to 5 years, then, you know, you see what aspect of dentistry you're more keen of. Get a lot of training, go to courses, talk to people, and learn the correct way. And looking back, you know, I went to many courses. You can tell from the cert on my wall. But right now, you know, I realized that, you know, the good thing is, you know, I really spend time learning, and I really benefit from that because, you know, like every time talking to somebody, spend time to actually go into the course, I learn something. Not only a new knowledge, sometimes it's actually a good revision of what we have learned, and just talking to people. We get a bit of connections, and then we get feedbacks and knowledge all over the year. This is how I benefited.
I want to ask you another question. You live in a part of the world where there's many different races and cultures. There's Malaysian, there's Chinese, there's Indians.
Yep.
You've lived in Australia. Do you see different decay rates for different cultures based on diet?
Yep.
Or do you think that the diet's not as important as the home care? Have you seen any variance in disease, missing filled teeth, decay rates among all the different races in Southeast Asia from diets?
No, in fact, you know, I work in different country for the last 20 years. I do not see a big differences, you know, in different races. I think, you know, it's all boils down to your dental health conscious. Some patients in many countries, there are a small proportion of patients that then really never taking care of their teeth. Then there are the patients that actually really suffer from decays, periodontal disease. But, you know, most of the patients that we see, especially our setting, actually, you know, they are quite dental hygiene is quite good. So I don't have a lot of problem in terms of that.
So you would say the difference in decay rate is more related to how you take care of your teeth,
Yep.
not on what your mom and dad are cooking you for dinner.
That's right. Yep.
Okay. Interesting.
Yep.
Interesting.
Yep.
And in your 20 years, going back from 2 decades ago to today,
Yep.
would you say Malaysia, the average child 20 years later has more cavities than 20 years ago, the same number as 20 years ago, or less cavities than 20 years ago?
I will say no. Compared to 20 years ago, there'll be less cavities.
So you see the decay rate going down.
Going down. I think because patient now that they understand the importance of I think at least personal dental hygiene. So if they take care of themselves, in fact, dental decay actually quite little now.
Because some people say that the whole world is drinking like more Coke or Pepsi or soda than 20 years ago.
Yep.
So some people think because of that, there's actually more cavities now than 20 years ago, but that's not what you're seeing.
No, not in our Malaysian context.
Not in Malaysia.
Yeah, maybe not yet. Who knows? But
Yeah, but you think there's less cavities in Malaysia now than
yes,
20 years ago?
because like when I first started, because I think patients are not exposed to dental health, so that is why a lot of them don't have a chance to take care of their teeth. So we see much more dental decay and much more hopeless teeth in the future, in the past. Sorry. So as per now, I do see a lot of improvement.
And does Malaysia I'm sorry,
Johor Bahru?
Johor Bahru.
Yep.
How many people live in Johor Bahru? It's a big town.
I will say, the whole Johor, which is the state, is about 2 million. Johor Bahru,
2 million.
Johor Bahru is about 1 million plus minus 300,000 because we have a lot of transients residents. They come from all over Malaysia. They stay in Johor Bahru, but they are working in Singapore.
And how many people live in Kuala Lumpur, the capital?
Kuala Lumpur, we're looking about at least 3 million.
3 million?
Plus minus because they have a lot of transients residents.
So
as well.
does Kuala Lumpur or this city, do they use water fluoridation?
We do have fluoride in our water.
Is it natural or is it adjusted by the government?
It's adjusted by the government.
Adjusted by the government.
Yep.
And how long have you guys used water fluoridation?
I do not remember the exact date, but as long as I remember, I think since 1970s, we do.
So when you got out of school, it was already in the water.
Sorry,
Yeah, where I live in Phoenix, Tempe put it in 1973.
Yep.
So you think it's about the same time period?
I think so. I think this is quite correct for Malaysian
And
context.
is community water fluoridation in Malaysia, is it controversial? Do some of the people in Malaysia want it taken out of the water, or
No,
is it
in
not?
fact,
is it not?
this hasn't actually created a big debate.
It's not a debate here.
No.
And very interesting.
Yeah.
So anything else you want to talk about? I know you're a busy man. You're getting ready. Well, tell us this. You're getting ready to fly to China.
That's right.
And you were telling me that China has 3 big meetings a year.
Yep.
Will you talk about those 3 big meetings
Yep.
and why you're going to them?
In fact, China, they have three big dental meeting in a year. I'm going tonight actually to one in Guangzhou. Guangzhou. There's another one in Beijing.
Beijing.
June this year. There will be another one in
Shanghai.
October this year. So normally, because they are quite big in scale, so we like to actually go in, meet people, talk, get ourselves familiar with the newer technology. I'm sure that every time I go in, there's more advanced CAD cams, gadgets coming up, so which I'm quite interested in. And also, right, not to forget, I love the food in China. So half business, half leisure. Yep.
Yeah. So you're flying there tonight?
I'm flying tonight.
So you'll fly from this city straight to Shanghai?
No, in fact, I need to actually commute to Singapore. I'm
Go
flying
to
from Changi Airport to Guangzhou.
To Guangzhou?
Yep.
And how long a flight's that?
I think about 4 hours.
4-hour flight?
4 hours, yep.
And how many days is the meeting?
It's supposed to be 3 days, but as I say, I enjoyed the food there, so I extended my trip, so I'm going to stay there for 8 days.
8 days.
8
Wow.
days,
Are you going by yourself or taking
No, I'm actually going with my wife.
taking your wife with you? So
Yep.
you're going to have a vacation.
Yep.
And I'm in your way, right? You're in a hurry. You need
No.
to-
I'm-
Well, is there?
I'm glad you dropped by.
Well, thank you. Is there anything else that you're passionate about that you want to talk about?
Of course, apart from basic dentistry work, I'm actually also very passionate about facial aesthetic. I'm actually one of the few dentists that actually has been trained to do facial aesthetic. So we do Botox, filler, chemical peel for patients. And as per now, myself and another dentist in Singapore, we actually conduct course to actually teach dentists how to use Botox in dental practices. That's actually where my current passion is.
Botox.
Botox.
And dermal fillers.
Yep.
Wow. And you see this, is this a significant portion of your office? I mean, is it more than 1% of your practice or 5%?
Yeah, I would say maybe between 3 to 5% of practice. But
3 to 5.
But I'm glad that I have another skill and another weapon that I can use. So if patient needs it, they do not have to be referred up. As you know, I like to keep everything under the same roof. So if I can do it for them, it's win-win situations.
It is the most exciting thing about dentistry is there's never a dull day. There's never a dull patient. There's never something you can't learn. I mean, you can just keep learning and learning and learning. Anything else you're passionate about?
I think for dentistry, that would be what I'm actually happy for the time being.
I want to ask you another question about the state of Malaysia. Is a big country, 30 million people.
Yep.
How many dental schools and how many dentists do you think?
As per now, we have 15 dental schools.
15 dental schools.
There is a big increase compared to just maybe 5 to 7 years ago. We have only less than 5. We have maybe 5 government dental school, and then we have about 10 private dental school. So as per now, we are churning out maybe 1,000 to 1,002 dentists a year. So as per now, I think the registered dentist number is about 9,000 in Malaysia.
9,000 dentists.
Yep.
And what is the state of silver fillings? If in Malaysia, what percent of the fillings do you think are done with amalgam, and what percent are done with composite?
I don't have the exact number, but looking at that, I would say still 30% of that, which
30%,
20 to 30% of that we done in amalgam, which I do not like to see. For myself, since after I actually set up my own clinics, I do not use silver filling at all. So
how many dentists did you say there were? 9,000.
About 9,000.
9,000
as per now, registered dentists.
Okay. But you don't like silver fill. I'm sorry, I interrupt you.
Yep.
You don't like silver fillings. Why?
First of all, of course, they don't look nice. Second of all, I do not like the idea of you putting mercury and metal inside the body. A lot of time, eventually, the tooth going to have a lot of problems. I do see a lot of cracks. I do see a lot of necrotic teeth because of amalgam, and of course, most patients do not like it because of the color. As per now, we don't, in our practice, we do not practice amalgam filling at all. So we're using tooth color filling, GIC, composite, which have improved tremendously for the past few years. We have CEREC, we have aesthetics crowns now, which is a good replacement for that.
Would it for a standard MOD composite on a first molar?
Yep.
What would your standard material be for that? What would your most
we'll most probably put in a composite for.
But what brand?
What brand?
Yeah, what brand?
We are using GC.
GC, General Chemical, out of Japan.
Yeah, Japan.
And they just moved their headquarters to Switzerland.
That's right.
And why was that? I thought that was a very long old Japanese company. Did it get bought or?
Okay. I'm not sure, but I don't know why they do that because I love Japan. I thought Japan is a beautiful country. Maybe because they are starting to tackle maybe European country. So probably by shifting the HQ to Switzerland may be a good idea. I'm not sure. But don't get me wrong. I'm not saying that Switzerland is not a beautiful country. I haven't been there. I've seen photos. It's beautiful. But I love Japan because food is fantastic. I love the cultures.
Yes.
I'm an avid traveler. I go to Japan once or twice a year.
Fantastic. So I know you're pressed for time. Okay, hey, I just want to tell you, it
You're
was
also
just an
pressed for time.
honor to let me and my two boys in your office today.
Thank you very much.
Thank you for taking time out. I hope
Thank you
you
very
and
much.
your lovely wife have a blast in China.
Thank you very much.
And if you're ever in the United States, you got to come by my home and say hello to
Sure.
us.
All right. Okay. Thank you very much.
All right, thank you very much.
Thanks for driving by.